my frustration is that I used to answer the phone. I would be the first person to talk to patients when they call, and we would stay on the phone a long time, give them a lot of information about hyperbaric oxygen and how it works, all of that. And then they would say, oh, I'm going to check in with my general practitioner or my neurologist. And then the neurologist's knee-jerk reaction is, don't waste your money on that. And then I say, there's published research out there. The doctors refused to read the published research. And that's contempt prior to investigation. Saying that something won't work, don't waste your money, when they haven't read the research. And they're denying this patient the ability to heal, changing the trajectory of their whole life if they would get hyperbaric oxygen and heal their neurological condition.
Part of that also is my entire generation of doctors was taught that this was a fraud because we have not understood the science of it until 2008.
But still,
I went to medical school.
They're not reading the science.
That's true, but they don't understand it. And so what has happened is, I went to medical school in 1976 to 1980. When I first was in the hospital in 1978, our first rotations, I heard someone mention hyperbaric oxygen for treating some patient. And I asked my main teaching doctor, what was that? And it's now in the preface to my book. He told me, oh, don't ever ask about it again. It's been thoroughly disproven, unscientific, charlatanism, snake oil sales, and fraud. And that's what my generation of doctors was taught, because nobody understood the science. And when people stood up and said, wow, I treated some patient with whatever condition, and he was bald and he started growing hair again. And we know now the reason and why that could happen. And I've actually had a number of patients where we've documented that with pictures. But in the absence of explaining it, the doctors were, I don't know how that works. It got discredited.
Or more importantly, treating someone with dementia who has a diabetic foot wound and their cognitive ability improved.
Exactly. Or as I talk about in the book, erectile dysfunction. People were claiming that this helped erectile function. Yeah, it did. What happened, diabetics with diabetic foot wounds and men, one of the very first symptoms of diabetes in them is erectile dysfunction. And it's due to not only elevated glucose levels, but also vascular disease to the tiny blood vessels that control the nerves that control erectile function. We also now know that erectile function is part of the pathway is the neurotransmitter nitric oxide. And what does hyperbaric oxygen do? It increases nitric oxide, the whole pathway. So we now know how this may work. But back then, when people stood up and made this claim, it was completely inexplicable. And as a result, it got criticized and people got to know, oh gosh, someone else making another crazy claim about hyperbaric oxygen. Now we understand how it works. But my generation has this mindset that this was a fraudulent therapy.
Yeah, but that was 50 years ago.
But those doctors are still alive like me.